Good afternoon. I'm Irina Berger, Administrative Director at Northeast Medical Practice.
And I'm Dr. William Berger, owner and founder of Northeast Medical Practice.
Dr. Berger, today is the National Day for Doctors, and I would like to first express gratitude to all doctors in the world and thank for such a hard work, and also speak to you a little bit about your journey and what are your thoughts about being a doctor nowadays?
Well, first of all, thank you for acknowledging National Doctors Day. And I also want to express my appreciation and admiration for all the doctors, the physicians and surgeons out there, for all the work that we collectively do. In terms of being a physician these days, as you say, it's coming with its challenges, certainly. I feel that we really need to band together as physicians and surgeons, as doctors, in order to take our power back. I think that hospital systems, insurance companies, the government have been trying to strip our position away to some extent. And I really feel that with our level of training and what we have to offer to our patients, we really need to step up and be our own advocates.
This is very unfortunate. I always thought in life there are two most impactful professions. I mean, one is a doctor, and second, it's a teacher, right? It's a huge, huge impact on people. And doctor, the journey of becoming a doctor, any country, anywhere, the doctor is always represent huge capability of, brain, and also the impact. In the end of the day, I don't think there is no other profession that would make such a phenomenal impact. Even like simple things like UTI, a doctor prescribes antibiotics, and in 5-6 hours you're already totally different person. Again, I am so grateful to all the doctors and very, very grateful to be part of this journey. But I also noticed, like I was, working at United Healthcare Group at one point, and we had internship program where we would hire children to finance a program where we would rotate them from one department to another. And we would work with the sophomores for 2 year, second year in with Hofstra student Baruch College. Those kids, when I would interview them, they would often say, both of my parents doctors, but I do not want to become MD. In nowadays, the money is not the same, the respect is not there. And also it's a huge grueling process. It's not only enormous loans, but then when you're getting to the practice, you're being pushed by corporate, you're being pushed by insurance companies. It's not the way I would like to live. It's much shorter to go to finance, get 4 year degree. If I decide to go for MBA, it's another 2 years. And, the life is much, much easier. So tell me a little bit about your point of view on this. Would you recommend for people to go into this designation and still be a doctor in nowadays?
I would. I wouldn't change my decision. And I would say for those of us who this really is a calling, you really feel like it's what you're meant to do, you're capable of doing it, then I really do think you should go for it. There are many options these days for us as physicians in the primary care space, as internists and family physicians, but also for specialists to establish direct models of care so that there isn't so much of a barrier between the physician and the patient posed by insurance companies, government, hospital systems. The number of independent practices in this country has been steadily declining because of so many administrative burdens that are placed on traditional practices. I really feel that people who believe that they're meant to become doctors, it's worthwhile not only for the fulfillment that you get professionally, personally, emotionally, spiritually even, but there are so many other models and ways that you can create a direct relationship with your patient, be it direct primary care, a concierge-style practice, anything in between the two, so that people can practice as independent doctors. They are going to be able to have more time with their patients. They're going to have that direct relationship. and there will be less of an administrative burden on them. So I still would encourage those who feel like they have a calling to become a doctor, they should pursue that.
So there is a concept of nurse practitioner, and this is something that, independent practice. Why do I need to go and get my MD when I can become independent practitioner and practice? Can you elaborate a little bit on this? I mean, and the entire, I would say probably 10, 15 years, because again, saving on the cost, right? I mean, I see this all the time that, and they call everybody middle level. I mean, the providers, even doctors being called providers. What is in terms of working independently? I mean, your path and obtaining all the credentials and tell me a little bit about this journey.
Sure. So I don't want to disparage any of my clinical colleagues, but the number of hours of training between a physician and a mid-level provider, whether we be talking about nurse practitioner or physician assistant, is very, very different. It can be disputed. Of course, there are NPs and PAs who've been in practice for a very long time and have a great deal of experience. But at baseline, then the number of hours of training is quite different. I do take umbrage at the term provider because it does lump us all together. And this is a term developed by the government and the insurance companies to make us all interchangeable. I don't think we are interchangeable. There may be a place for all of us in the medical space, but to me, if you really want to make full use of one's capabilities, again, I think you should pursue the medical degree. And I do think that the mid-level provider is a creation of the government and the insurance companies and the hospital systems in order to pay clinicians less. Again, I don't want to disparage my colleagues, but there is just a difference in the level of training.
And when it comes to DPC and concierge, I mean, is it a lot of doctors and they would love to walk out from slavery of hospitals and really these clinical settings? Widespread this movement is, and how brave your colleagues are nowadays.
Well, first of all, I want to applaud all of the physicians out there who have taken this step to take their power back, because I think it is the best way to provide care. It is growing, whether we be talking about the direct primary care movement or any kind of concierge-style practice across the board.
Can you touch base and tell the difference between
Sure.
and concierge?
There is kind of it's a spectrum, and there's overlap. In general, direct primary care practices have opted out of insurance and just have a direct financial relationship with their patients and don't bill insurance. Concierge practices tend to often bill insurance plus an annual or monthly membership fee. The prices, tend to be lower in direct primary care for membership versus concierge, but there's plenty of overlap between the two. But in general, the idea is that you're going to take better care of your patient, you're going to have more time for them, you're going to have a smaller panel so that you can know your patients well, and then all the different permutations of different services that you might want to offer, etc. So it's a spectrum across the world of direct care, but it's all growing because patients are dissatisfied with the kind of care that they tend to get from bigger group practices, or especially from the corporate-owned.
And what is your prediction? What are you thinking about going to happen in the near future?
Well, I think all the direct care models will continue to grow, and we may end up with some sort of a two-tiered kind of medical arrangement in the United States. This exists in other countries where you're not talking about private insurance versus a direct care model. You're talking coverage of insurance versus private. However, I think there may be some development of that, but a couple of things can buffer against that. One is the more physicians who decide to go into primary care types of residencies, internal medicine, family medicine, and start direct practices, and as opposed to choosing necessarily specialties. Nothing wrong with that, and there are also direct care models for some specialists. But the more people who choose primary care type practices, and that includes pediatrics too, then the more there will be growth in that space, and the direct care part of the spectrum does tend to charge less. But regardless, when you own your own practice, you can make exceptions for people. You can have scholarships for people. You can help people to get care whether or not they're able to pay your full membership fee. So I think that there can be a lot of growth in the direct care space, that we can take care of patients across socioeconomic status. But will it be enough to see all patients? I think only time will tell, but that's going to be a little bit of a challenge given the number of people in this country.
Have you ever felt that you've been abused by the system?
Sure. I don't think I'm telling tales out of school when I say that to not have any control of your schedule, to be forced to see 20, 30 patients per day, to have 2,500 to 3,000 patients on your panel, to be told, well, we don't have nurses today, we don't have medical assistants today. You handle everything, and also all the callbacks to the patients. And I would never be willing to give a patient a 7-minute follow-up visit or a 15-minute annual physical. So I would run late every day, trying to give my patients enough time. And then I would be up charting until the wee hours of the night because I didn't have time to complete my notes and get back to people about their medication refills, lab results, etc. So absolutely, it's the reason for such high burnout in medicine.
And tell me a little bit about what is the percentage of acceptance rate when you're getting into, medical school, and how difficult, what is your GPA should look like? And tell me a little bit about what kind of student and candidate you need to be in order to get into medical school.
Okay, well, in my last I checked, it's been a little bit since I got into medical school, but on the order of 2% of acceptance rate. Of course, you need to have a high grade point average, and you need to, of course, do very well in all of the pre-med classes. You may want to go out and get some experience through internships or working prior to applying to medical school. Some people go on and get master's degrees, a master's in public health, for example, or do other research in order to get into medical school. It's not easy. And
why don't you tell me a little bit about residency and rotations, and how many hours in the residency you were supposed to work, straight shifts?
Yeah, so it is a little easier than for my forebears who had a 120-hour work week. It was an 80-hour work week when I was going through residency, but there would be 27, 28-hour shifts every third night, depending on what rotation I was on, it's very, very grueling. In internal medicine residency of 3 years, you do 10,000 plus hours of training. This is like Malcolm Gladwell's magic 10,000 hour rule for what does it take to become a master of your craft. And that really is what residency is. And it's trial by fire. You see things that you probably wish you could forget. And it's very, very grueling, but you come out knowing what you're doing. And even then, I think there can be an advantage to getting some experience working with someone else prior to going out and striking your own path as an independent physician. So it's a long path. It's a very challenging path to begin, and then it's challenging and grueling to get through. But you come out really well trained, and I think able to provide the best care.
And when you're referring taking power back in your story, how does it translate?
Well, I think it really gives you the personal satisfaction to know that you're taking the best care of the patient that you can. You can't entirely eliminate insurance in terms of the necessity of prior authorizations for medications or imaging studies, things of this nature. You may want to continue to bill insurance in your direct care model, depending on which one you choose, but you become the captain of your ship, and you determine what kind of care, what kind of services, how many patients you want to have in your panel, how much time you want to give them. Are you going to be available at all hours? Are you going to advocate for them in the hospital? Are you going to make house calls? Those things which we offer in our practice. It's entirely up to you. You get to make those decisions.
Let me ask you about the self-care. A lot of times doctors being burned out, and they also highest rate of suicide. right? Because you can't just
Among the highest.
among the highest. How do you take care of yourself now, comparing when you worked for the systems?
Right. So we're fortunate we chose to open an office close to home, so we don't really have a commute to speak of. It allows me to meditate every morning, to go to the gym every morning, prepare a healthy lunch that I'm going to take to work. We really are able to walk our talk because we focus so heavily on lifestyle and prevention in our clinic. We're able to take care of ourselves in the same way that we're always recommending our patients to take care of themselves. It's really important.
So I remember you reflected and once said that one of your mentors, physicians, he was saying to you, in order for you to become greatest in your field, every day you have to read. How much development are you doing now versus when you were working in, for the health system?
Well, I absolutely have more time to read, and I'll give some acknowledgement to Dr. Joseph Lieber, one of my mentors in residency. He, yes, that was what he said, is you must read. And I have much more time for that now. I can read about my patients and get into their medical history much more deeply and research conditions that they have. Are there new treatments? Are there new thoughts about the pathophysiology, whatever the case may be? And also just what's up and coming in the various fields that I specialize in, such as weight management, menopause practice, as well as general internal medicine. So learning from my patients, being able to read about their particular problems much more deeply. And I also have time to talk to their specialists as well, and really maintain good connections with them so we don't operate in separate silos. You have much more time to educate yourself and also take better care of your patients.
Wonderful. Let me ask you, what would you recommend the youth who is still interested in going into medical field?
I would recommend to get some experience, get some exposure, volunteer, and so forth. Shadow people, whatever you're able to come up with as an undergrad, and read as much as possible and go for it, because I think there's nothing more fulfilling if you feel called to do this.
Wonderful. Thank you, Dr. Berger. Again, happy National Doctors Day.
Thank you, Irina. Happy National Doctors Day to all of you out there. And yes, all the physicians and surgeons, be strong, take your power back, give the best care you can to your patients. Be in good health.
Be well.